Thanks for tuning in to Conversations with Betty Lamarr, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South.
Hey, Lucretia.
Hi, Miss Betty. How are you today?
And I'm busy looking at the camera, girl.
It's okay.
Okay, it is.
That's what we do.
are on the red carpet,
That's what we do.
Okay, look. Today is going to be very exciting, everybody. This is really good. Our guest today is our viewer's choice.
Okay.
Lucretia, you know, you and I talked about this. We watch the TV commercials a lot.
Yes, we do.
About HIV disease.
Yes.
And so many people ask us all the time, you know, just because we're, you know, black
what we
women.
do, right?
Yeah, why does the commercials seem like they only refer to black men? Like HIV is just a black man's disease.
Right.
Right? So, you know, we had to get the master.
Yes.
Okay, she's my go-to.
Okay.
For HIV.
Yes.
So I'm just really excited about it.
And you know, we love to roll out our red carpet for our special guests.
You
so
know
would you
it.
like to tell our guests today who we have on the red carpet?
Absolutely. On the red carpet today is Dr. Marye Bernard with Spirit Health Medical. And so we'll be right back with one of the masters.
Hello everyone, thanks for watching Conversations with Betty Lamarr. Conversations are focused on people like you doing things to uplift the city of Memphis. Betty Lamarr invites you to watch this space on Xfinity Cable Channel 17 and her YouTube channel, Betty Lamarr Memphis.
Welcome back to Conversations 901 Conversations. It's all about Memphis and the Mid-South. Okay, as we mentioned earlier on the red carpet today, we have Dr. Marye Bernard, and I like to say she's the master. Definitely one of the masters. And she is my go-to doctor for anything and all things HIV. So today, we're going to talk about basically women and HIV. Okay, so Dr. Bernard.
Hello.
Yes, welcome to Conversations 901.
Thank you guys for having me. I'm honored. Thank you.
Oh, we're honored. We're honored
Absolutely.
because we've been talking about this for a while. And I said we gotta
Have her on.
get Dr. Bernard on.
Yes.
So Dr. Bernard, now we watch the TV commercials and they're on all the time.
Yes.
So the question that everybody has is, and I want you to, we're going to go into this, but I want you, after I say this, to first of all start it off with introducing yourself and tell our viewers, you know, who you are and what you do and where you do it.
Okay.
And after that, I want you to talk to us about the statistics, if you will, of women that are living with HIV disease.
Okay. All right. I'll start out by saying I'm Dr. Marye Bernard. I'm the co-owner and a provider at Spirit Health Medical, where we provide primary care to anyone, but we specialize in HIV. Women in HIV, oh my God, you just stepped all over me there. My platform is prevention.
Okay.
I believe that black women are at the greatest risk for developing HIV, for contracting HIV.
Okay.
And they can protect themselves, but most of them don't know it.
Okay.
Because as you say, the commercials don't indicate that it's a problem for women. It looks
Right.
like it's just a problem for same gender loving men.
Yes.
Yes.
And that's unfortunate because that's not the only statistics. Yes, 1 in 2 men who have sex with men will be HIV positive, but 1 in 22 black women will be HIV positive. Yes, and then when I look at the statistics for other people, like white women, it's 1 in 200.
I was going to ask you about that. I'm glad you said that. I'm going to jump in because that was something I was going to ask you anyway. Is it as prevalent for a white male or female as it is in the black community?
No. As a matter of fact, with the prevalence now, if you look at it like a big pie.
Okay.
About 75% of new cases are in people of color, and that's people brown and black people. Only 25% are in whites. And when you look at that, those numbers, it's mostly black men, but black women or women of color also impacted too. White people are not nearly as impacted by HIV as black people.
Why?
I knew y'all were going to say that.
Is there a study as to why
Let me tell
that
you-
is the case?
Let me tell you some things that have been impeding. One, the Bible Belt. We don't want to talk about sex.
Yes.
We don't want to talk about sex, and we certainly don't want to talk about same gender loving sex.
Right.
That's one. Two, we don't believe the science. We believe our neighbors.
Yes.
We don't believe the science. The science
Right.
is there. We know for sure how not to get HIV, but the neighbors say different, so you do what the neighbors say do. And so if you really sum it up, it's lack of education. Because if people were educated about it, then they would do something about it. For example, the Department of Health and Human Services has a campaign called 90-90-90. That's been the goal in ending the epidemic. And you know, ending the epidemic is nationwide, but there are 10 cities in the United States, and Memphis is one of them, that has the highest rates, and where the focus was just honed in just on Memphis. Just on Memphis. A lot of money came for prevention. And so what they suggest is that we get 90% of the population tested.
Okay.
And then of those who test positive, get 90% of them into care.
Okay.
Okay.
And once, let me finish, I gotta tell you the whole story because
Yes,
it's gonna make
ma'am.
sense to
Okay.
you. And once we get 90% into care, get them undetectable where the medicines work, because if they're undetectable, they can't transmit this virus.
Okay.
See, undetectable means untransmittable.
Okay.
So we can get people tested, get them into care, get them on medicines, get them undetectable. We can stop this thing.
The
in the black.
spread. That's
We can
right,
stop
the
it.
spread.
Yes, and I'm sorry, I just had to tell the whole story.
No, it is fine. But the question I have is, I know you said that to get them tested, but how do you spread that information? Because this is the first time I'm hearing it. So how do you get that out there to make people more aware of these things, to get them tested, to just make them aware of it?
Other than just if you're gay.
Right.
Right, and that's the biggest misconception.
Yeah.
But again, social media is one thing, but there are lots of organizations out there that are trying very, very hard to work at prevention. They are going out, they're going to the clubs, they're going to the malls, they're going places offering tests, offering prophylaxis, condoms, and so forth. And then they are linking them to care. There are people out there. But what you just said is really what symbolizes most black women. You hadn't paid attention because it doesn't pertain to you.
Right.
You're
Right.
beautiful,
Right.
you look good, you
Well, thank
got pretty
you.
stuff, you ain't got to worry about it. That's what you think.
Right.
Yeah,
And
that's what you
that's
think.
the reason why so many black women are not protecting themselves. Did you know you could do that? Did you know it was some medicine that you could,
I had no
girl,
idea.
it's 2 medicines you can take to not get HIV. Like birth control,
What?
we got HIV control.
Wow.
We got HIV control. We have the form of a long-acting injectable, where you get a shot every other month, or you can take daily pills, and not get HIV. Just like birth control pills, you can take your 1 HIV prevention pill every day and your 1 baby prevention pill every day.
Okay, now let's go into the penal, the jail. What do you call that?
The penal system.
Okay, penal system. How much is that is coming from the jail? Because I don't know any woman that has had a husband, boyfriend, or whatever in jail that really don't believe that he may have been compromised. Because they think because they went in straight, they're so bad, nobody can whip them and take anything from them.
Right.
So how much of it, we know there's a lot of incarceration in Memphis. So how much of that do you think is with the women, black women getting infected, has to do with jail?
I don't know if that's a fair question, because we're not testing folks as they go in.
Okay.
So
Okay.
we can't evaluate them when they come out, because that's not
Oh,
fair.
yeah,
Because some
true.
of them may have went to jail HIV infected. But
Already.
you bring a good point that sex in jails is not the same as sex on the street. Sex in jail is money.
Yes.
It's protection. It's to get along with people.
Oh,
It's
okay.
more than it's not sex in the jails. It's
Okay.
not what we
Right.
call intimate sex.
Right.
Someone may have sex just to keep from getting beat,
That's
Okay.
right.
Right.
or they may have sex with someone because you have some zuzus and I want some.
Right.
So,
It's just different
It's different,
circumstances.
yes. So I'm not sure we can fairly say that, but I will say this, that any woman who loves a man who's been incarcerated, instead of throwing a big party when he comes home, baby, y'all go get tested
Tested.
together
Okay.
and then have the party.
How
So-
long does it take to detect HIV?
There are different types of tests,
Okay.
and some of the fast-acting tests you can detect it within 1 to 2 weeks. But most of them take just a little bit longer from the time of in exposure to the time of the test turning positive.
Okay.
So pretty fast, though.
Pretty fast. Okay.
Okay, and what about many years ago, Dr. Bernard, I did a charity event on Bill Street at the New Daisy for women and children with AIDS. So what is the prevalence now with children being born with HIV?
This is a great question. Less than 1% of women who are HIV, they have less than 1% of the babies born to women who are HIV positive are positive because they don't have to. You can take medicines during your pregnancy.
Pregnancy.
Wow.
And during labor and delivery and have an HIV negative baby. In my 29 years of taking care of people with HIV, I have never had an HIV positive baby. Not a
That's so
single
good.
one.
And how safe, because you know it's very important to protect the child while it's in the womb, but how safe are the medications for the mother to take while they're pregnant?
Now, you're going to say I'm being a smart aleck, but I'm going to say safe enough to have an HIV negative baby. But I hear your real question is what's the impact on the pregnancy?
pregnancy.
So there's no real studies that look at what this does to pregnancy, but there are retrospective reviews
Okay.
of women who were pregnant, who were in studies, and what things happen. And for the most part, they do just fine. I don't even change medicines anymore. You know, if they were on this medicine when they got pregnant, we stay on this medicine. You go to OBGYN, you stay on the medicine, you know, because we know that most of them are safe.
That's great.
And also, you know, I had a family member many years ago, back when, before they had the meds, when they just really suffered out of here. It was just,
It was sad.
just,
I was there,
oh my
it was
God,
sad.
yes. But, so, what's the, what do you call it? The life expectancy, if you will, now that we have medicine where my family member didn't have back then. And do they still get that sick at some point?
Well, I love you guys. Y'all let me just tell everything.
Yes.
So research has shown us.
That's why you're here.
Yes.
You're the master.
Yes.
Research has shown us that if we can start a person on medicines while their immune systems are healthy, as evidenced by a CD4 count of 500, that their lifespan is the same. The sooner we get you on medicine, the less your immune system has been damaged, the more equal it becomes.
Wow.
Now, most people are not dying from HIV and AIDS these days, or the complications thereof, because the medicines work.
Okay.
They're simple. Most of the regimens are either 1 or 2 pills once a day. And most people can tolerate that. They can even have that when stigma is a problem. You can have one
Yes.
pill.
Right.
You know what I'm saying? You put it in a Tylenol bottle, anything.
Nothing.
Yeah, so people have access as well because of the various programs, especially those funded through Ryan White. People who would otherwise not have access have total access, perfect health care. And so in this day and time, no one's getting sick but those who choose to.
Okay, that means they're not on the meds.
That means they just will not take them. They will not.
So what are some signs, say if I don't go and get tested, I'm not even thinking I have HIV,
Just out there.
I'm just out there. What are some signs to make you say, maybe I need to go get tested and something's not right? What are some things that can kind of just show you a telltale that something's not right with your body?
Well, there's a syndrome called seroconversion. You have an encounter today, and sometimes within the next 2 or several weeks, little nausea, vomiting, diarrhea, rashes, feeling bad, just feeling bad. Because remember what happens is that there's an influx of this virus in your body, and it's smacking your immune system. So your immune system goes down because it didn't know this stranger. So you have a
Okay.
whole lot of virus in your body, and your immune system is impacted. So things can happen right there. But after that syndrome, it may take many years before anything else shows up.
Wow.
Right.
So if you go to the doctor and you're not even aware of what to tell the doctor, do you think the doctor will automatically text you for HIV?
Well, it is recommended. It is recommended. The Department of Health and Human Services say that all adults, and we start at 13 when we say adults, should be
Yes.
offered an HIV test at least once in their lifetime, but
That's right.
preferably every year.
Yes, because I go to the VA and my doctor asked me, I get HPV every day.
Everything, yeah.
Yes.
Yes.
Yeah.
And now I feel like I'm really safe because your girl is not out there or in there, period, at this point in my life, right? Single
Period.
black female ain't doing it.
Right.
Okay, so, but it's good to know. It was very refreshing to know that I was negative. Because a lot of people would never get tests because I don't want to know. You don't want to know.
Right.
Yes, you do.
Yes, you do.
If you saw my family member, you would want to know.
Right.
Because
So
you
go
want to
see
get in
Dr.
care.
Bernard.
You want to get in care because the treatments are simple.
Okay.
They're very, very simple. The pills that we offer now are no bigger than a ibuprofen, Tylenol, not much bigger than
Is that the Magic Johnson medicine that you call it?
Well, actually, I don't know what Magic's regimen is anymore. He used to be on Kaletra and some other stuff, but I am sure that he is on one of these new one pill once a day. Right?
Yeah.
I am sure he is, but I don't know his exact regimen. I should have
Right.
looked that up.
Yeah,
before
because I
came,
saw
but-
him on a commercial the other day, and I thought about you. I said, "Well, I'll be interviewing her Saturday," so that's pretty cool. Because he looked good too.
He does.
Yeah,
Absolutely.
he looked really good. So let me ask you this: so is it drug users, or just sex, or a combination of both, that's causing people to transmit the disease? I think is what I'm trying to ask.
Well, I think before I can answer that, I need to point out that there's the social domino effect. So if I'm broke and John Boy got some money,
Okay, yeah,
I'm gonna give him some sex.
Okay.
Because I got my children to feed.
That's
See,
right.
So that's the social domino effect of that. And so I think that most people don't want HIV and will do what they can to protect themselves, but they will do what they have to do to survive as well. I don't think that people intentionally get infected, but I think they don't understand the risk. Because people believe you can look at a person, watch them and tell if they're HIV positive. My patients are gorgeous, but my patients can't infect you because my patients are undetectable.
Okay.
And so that's the goal, to get everybody in care, under somebody's care, so they can, be on medications and be a part of the solution.
Okay. So let's go back to we're going back to the black people and the white people thing, right? Is there a reason? Because every doctor I interview, I don't care if it's diabetes, kidneys, it's always black and brown.
It is. It's
So-
a higher risk for us.
Yeah. So why do you think it's not as prevalent?
Well, I think again, it's a social domino effect. We're less educated in some areas.
Okay.
So if we don't know, we don't do.
It's
Right.
true.
Access is limited in some cases, where people are uninsured, and but if you have a baby, you can get insurance. But now you're a single mom that's got to feed that baby
Right.
and
Yeah.
house that baby. There's the fact of the access not being equal. There are clinics for some people and private doctors' offices for others.
Yes.
And so
Yes.
those
Yeah.
type of things, stigma, treatment. You go one place and they yell your name out and say, "You here for HIV?"
Right.
Versus someone else saying, "Miss Lamarr, you're next. Come on back
Yes,
with me."
exactly.
So all of those social dominoes play into why I think African Americans and brown and black people are more infected. And again, the myths, the past myths, Tuskegee didn't help us none.
True.
But we have to get past and understand Tuskegee.
Yes.
People think that
Right.
they don't understand the treatment was withheld, not given.
Not given.
That's right.
Right.
To see, it was like to see
true.
what syphilis would look like if they let it just go and go, so they could see the end result, right?
Right.
And you suffer through.
Right.
Yeah. So you're right, because like somebody that's very close to me, that's 89 years old, never had a colonoscopy.
Oh, wow.
And that's another thing too, since we talked about, since the sex word is in the conversation. What is it, Dr. Bernard, about a lot of black men that have this issue with anything that's got to do with their backside? They don't want to get a colonoscopy because they don't want to get their prostate exam. I mean, what's up with that?
It's the same social systems there.
Right.
I'm a man. I ain't no punk.
Yeah.
It's
so I'm
the
not
same
gonna let
thing.
you examine me there, even though it might save my life.
What
But
they-
again,
What they always
education.
say, if I'm going to die from something.
No, that's a cop out. You don't want to suffer. You know, that's
Right.
the way I look at it. I'm going to do whatever I have to do because it's about my health and wellness.
Absolutely.
Okay?
But you do that because you're wise. You know that.
Okay.
Yeah.
People don't know that. Prevention is what we're going for.
Okay.
I'd rather prevent your problem than treat your problem. If I can get you on medicines
Yes.
to keep you
Yeah.
from getting HIV, I like to do that. If doing a prostate exam will help me detect prostate cancer earlier,
Yes.
I want to do
Yes.
that. Same with the mammogram, pap smear. Screenings are important. We want to prevent these things, and if you do have them, we want early detection. It's the same with HIV. I want to prevent it.
Right.
But if you get it, I want to get to you early so the outcome is much, much better.
Yeah, I just don't understand that because people ask me sometimes, because I'm not a doctor, high school graduate, went to the Army, but they always say, why do you want to do medical talk? Because I could be talking about all kinds of nonsense, right? Because this is the Betty Lamarr show. So I said, because you don't understand, I get free advice on how to stay healthy.
Absolutely.
If I want to learn about something, all I have to do is invite that doctor.
It's very informative.
Okay? So I say, and when they go on TV on Monday nights at 7 o'clock, then everybody that watched the show, the doctor's giving you free advice on how to be healthy.
Free advice.
Right? If you don't want to go have a chronic kidney disease,
This is how.
This is it.
This is it. Just
Okay,
watch
get
it.
your blood pressure down, take care of your diabetes, get the A1C. So that's why I do it, because I feel like it's like a public service for me.
Right.
And that's why I appreciate you all so much, Dr. Bernard, for just coming on with me, because I know you're busy. But
Right.
you all are taking care of us.
Taking care of us. Absolutely.
Yeah, and it is a public service. And that's another reason I love my show, working with the doctors too, because they're always willing to make that sacrifice because they see it as
They
such.
want to do their part as well
Yeah, it's
to
a public,
educate
it's
us.
helping people. And if you happen to come to my clinic because you need me, great.
Right.
But if you don't need me, great. That means maybe you listened to me on the last Betty show, right?
Right.
Okay, you remember seeing me, Betty and Lucretia, we was talking about these things. But Dr. Bernard, I want you at this point to just tell everybody anything, the viewers, anything that they need to know, so we can just sort of sit back and learn something. In other words, we're going to let you wrap it up with anything that we may have not covered, or you can go back, just do a recap on everything, because I want everybody to make sure they just tuned in what we're talking about and what you do, and I said before, and where you do it.
Yes, ma'am. Okay. So first of all, the first point I want to make is HIV is 100% preventable.
Okay.
Okay.
It's 100% preventable. There are medicines out there that you can take to prevent HIV. Now, we would like to say go old school abstinence and so forth, but we know that hasn't worked. And how do we know that? We look at the incidence, the new incidence of HIV infections across the United States and even in Memphis. The vast majority of the new cases are in people of color. The fastest growing new group is that age group between 13 and 24. Now, when I pause there, I get nervous because during those years, 13 and 24 was when I was being socialized, educated, and having the opportunity to be an adult for the first time.
Right.
But if I'm HIV positive by the time I'm 24 years old, that changes the platform. It changes the cascade of everything. Women, black women, are at risk, at a higher risk than any other group of women for getting HIV. We can contribute it to myths, we can contribute it to lack of knowledge, lack of trust, the social domino effect, whatever it is. Black women are in danger, but they can protect themselves. Treatment is available. Treatment is not like it used to be. It's very simple for the most part. 1 pill once a day. At max 2 pills. Medicines are accessible. If you're uninsured, there are Ryan White clinics across the city that will be more than happy to enroll you into care. There are places to be tested. I prefer to send patients, I'll be just flat foot honest, I'm an advocate for Friends for Life, the new name Friends for All. I go to the corner, you can get tested for free. You can get tested and get into care the same day. I'm a part of Spirit Health Medical. We are a primary care facility that specializes in HIV. My partner, Dr. Marye Turner, and myself are certified by the American Academy of HIV Medicine, and I sit on the steering committee and stands for and represent the South as a voice when we're doing things. We've taken care of people living with HIV for about 30 years combined with us. Wow. What we offer that's different is it's safe. It's no stigma. You don't know why you're there because we're a primary care facility. But if you don't come to us, that's fine. Go to Sunbath. There are many places around town that provide HIV care, and it works.
And could you just go to the health department?
You could just go to the health department, to one of the local clinics. You can just start there, just get tested. And there's lots of testing events. And I think that as a people, we need to pay attention to the things that are happening because funds are rolling out of Memphis for prevention, and that's what we're talking about right here.
Okay. So if you know then that you are sexually active or at risk, I think you said earlier, it's just a good thing to get checked. Just because you know you're not abstinent, right?
Well, I would say prevention first. I would say prevention first, and then, And even if you can't get the pills, condoms or dental dam, just a barrier method, something, just something. Don't let body fluids mix,
That's right. I used to sell those dental dams in my store. I had like an adult store, and I learned about them from somebody asking me, did I have them? I'm like, what's that? Oh, okay, I'll order some from the store. What do you do with them? Oh, okay. That's important.
Yes.
So how prevalent, to your knowledge, is like herpes, or does all of that go together?
Well, let me say that sexually transmitted diseases encompass a lot of things: herpes, syphilis, gonorrhea, chlamydia, trichomonas, and of course HIV, and some of the ones that we don't see so often, like LGV and things like that. So herpes is just one of the sexually transmitted infections, but it's the one that is most likely to occur. Most people have been exposed to the herpes virus, but you got to keep in mind, a cold sore is herpes.
That's right.
Chickenpox is herpes. So in the context of it being sexual, we don't see that quite as much as we used to.
Okay.
But it's still out there. And again, it's preventable with a barrier method. I don't have a herpes prevention pill yet.
Okay, so before we wrap, this is a question I've always wanted to ask. I don't think I've never asked you, but I'm going to do it today, since we're speaking about women, because they always showing the men, remember, on TV kissing and stuff.
They are.
Which is fine, but don't make it just look like it's all this, need to look out for themselves. What about girl to girl? Female, like, with each other.
The transmission.
What's the word? What's the terminology for that?
Same gender loving. Yeah, the infection rate between same gender loving women is low. It's very, very low, right? Because you got to remember that the body fluid has to have a point of entry. You know what I'm saying? And so it's just not that common.
Unless
blood.
Blood. Unless one of them have been with a guy that.
Well, now wait, that's not fair. You said women to women. You didn't tell me about their history. Now. Wait. When you said women to women, I'm thinking just that's just it. Done. But now, if she's been with a man before or dips with a man sometime, well, and then you do that brings a whole nother
that can happen.
Landscape. When I ask patients, I says, how many partners you have? They said, well, I'm one-on-one. I said, but how many do they have?
Right.
That's
that's the major question.
Okay, now we're going to wrap it up. Dr. Bernard, before we go, did you give your address with Spirit?
No, but I would love to. Spirit Health Medical, 1331 Union, Suite 1240, Memphis, Tennessee, 38104. Call us at 901-522-5341. We're there to serve. Thank you.
Thank you, Dr. Bernard. We appreciate you so much.
Absolutely.
Okay, Lucretia, we had a wonderful show today.
Yes, we did.
I learned a lot. Did you?
I do, always, every time.
Yes. Okay, everybody, thank you again for tuning in to Conversations 901, 901 Conversations, and also Medical Talk with Betty Lamarr. We'll see you Monday night at 7 o'clock p.m. on Comcast Channel 17, YouTube, Betty Lamarr, Memphis.
Hello everyone, Thanks for watching Conversations with Betty Lamarr. Conversations are focused on people like you doing things to uplift the city of Memphis. Betty Lamarr invites you to watch this space cam on Xfinity Cable Channel 17 and her YouTube channel, Betty Lamarr Memphis.